Good afternoon, and thank you for joining us at this media briefing. Over the last few weeks, we've seen a gradual return of activities in our region, and as we mentioned on Friday, we're going to see more reopenings this week. This Friday, June 19th, several businesses and activities will be able to reopen if they've taken the precautions and steps they need to take. Those reopenings include personal care, like skin care services, electrolysis and waxing, nail salons, tattoo parlors and piercing shops, and massage therapy outside of those in healthcare settings. We know that many of you are eagerly looking forward to the reopening of these services, but as we have cautioned throughout the past month with other reopenings, the fact that these businesses can open shop doesn't mean that we can let our guard down. The virus is still out there, and we are seeing increasing numbers of cases in places like Arizona and across other parts of the country, and even here in California. So that means we must continue to be vigilant. Our local businesses are doing a good job of requiring face coverings and putting up signage to make sure people maintain social distancing inside stores and markets. I applaud them for their efforts to keep both their customers and their employees safe. But I have heard and seen reports that some people are letting their guard down and certainly not wearing face masks outside in public or keeping their distance from other people who are not from their own households. We cannot stress enough that we need to continue practicing safe habits. That means wearing facial coverings, maintaining at least 6 feet of separation from others, and washing your hands or using hand sanitizer. As we've discussed repeatedly, our reopenings have only occurred because our discipline in following these protocols has been successful. We are monitoring our health data for information that could trigger a pause in our reopenings or other measures to prevent the further spread of COVID-19. We don't want to do that. You don't want us to do that. So let's not let it happen. Like they say in boxing, protect yourself at all times. As we see reopenings of private businesses, we are also seeing more activities in county government come back to life. This morning, we reopened the County Administration Center in downtown San Diego for counter service, and there were people lined up early to take care of their business. We're happy to welcome people back, and we're eager to serve the public. But we ask for your patience and understanding as the way we have served the public is going to change. It's going to be different from what it was before. We want to keep the public and our county staff safe and healthy, so we'll be requiring physical distancing and taking other measures like sanitizing surfaces. Thank you, San Diego, for working with us. We sincerely appreciate it. We've had a weekend's worth of data to go over, so let's go ahead and get started with Supervisor Fletcher and his data report.
Thank you, and good afternoon. The state of California has made a modification to their guidance surrounding religious events and activities. Previously, the indoor, which has not changed, remains. That was the previous guidance they'd given, that you could do 25% of occupancy or 100 individuals, whichever is less. That remains in place for indoor services, but they have expanded that outdoor services can occur provided that they can maintain physical distancing between individuals. And so they're allowing whatever the natural surroundings allow for, provided that you can physically distance between individuals. You can do outdoor services without a limitation on the number of people. They've also modified that this applies not only to religious services, but to cultural services, constitutionally protected activities like protest, as well as weddings. And so those entities can now all take place under the state guidance, again, provided they follow the restrictions. If it is indoor, it's 25% of occupancy or 100 people, whichever is less. If it is outdoor, there is no limitation on the number of people, provided that the natural terrain where the event is taking place allows for the physical distancing of individuals. The governor today also talked a little bit about the progress we've made as a state and what allows us to move forward. He highlighted that 13 counties in California are not meeting the metrics of where they ought to be Fortunately, San Diego County is not one of those at those times, which allows us to continue to move forward with our reopening. But again, as you just heard, we need the public's continued help. The reality is we see a number of places around the country that are seeing significant spikes. Many of those places were places that started their reopenings 3 to 4 weeks ahead of us. And so we want to be mindful that we want to go through our reopening process better and more responsibly than some of those other places did. And so that is what calls on us to really adhere to the face coverings, the physical distancing, the hand washing, the temperature checks, and our efforts around T3, testing, tracing, and treatment. Those are the two things that we think give us the best opportunity at being able to manage or contain the spread of coronavirus in a way that keeps us under our 13 triggers, that preserves the integrity of our healthcare system, and allows for a continued reopening. We had a very successful end of the week last week and weekend in terms of testing numbers. And so we've seen a pretty considerable jump, which is positive news. Some of it is a reporting of a backlog of some testings that we had. And so we're going to work to maintain and keep our numbers up where they are. But as we go to today's chart on T3, you'll see we are over our daily goal both for today. You'll see today we're reporting 5,207 tests. But more importantly than the individual day, our 7-day average of tests is now over that initial goal we had of 5,200 at 5,277. This represents tremendous work on the part of our public health lab, our health and human services staff, partnership with our healthcare system and the testing that they do, along with our commercial labs and the state of California and the drive-up testing that they have available. So we're going to continue to push forward and push ahead, but this is encouraging news. We have our 7-day average above our stated goal of 5,200 and our daily totals above that as well. And we're now over 230,000 tests that have been reported in our region. And so this puts us online with some of the counties that have had the most success in testing, particularly urban counties that have had the most success in testing. Contact tracing also continues to bump up. You see at 439, we're really close to our goal of 450. And we expect in the coming week or so this number to jump quite a bit as we bring on a new cohort of promotores that can help us with our community-based contact tracing. And so we will continue to these two pieces being an anchor of our overall system. And then you see our treatment. In terms of today's positive, we're reporting 170 new positive cases. Again, this is out of 5,207 for a 3% percentage of positive. That 3% is right in line with our rolling 14-day average at 3% of the total tests we've done reported positive. That number will become a little bit more clear as far as a percentage when our testing stabilizes over time. But again, that's why we look at the 14-day rolling average, which is holding relatively flat across the preceding several weeks. Hospitalizations, again, holding generally flat. Here you see here, we have our COVID-related in ICU, our non-COVID-related ICUs down a little bit from yesterday, non-ICUs up a little bit. But again, holding relatively flat over the preceding month. And then you can see the COVID hospitalizations plus non-COVID hospitalizations on the next slide here, which puts us just under that 4,000 number. Again, you can see the 4,863 is the 80% we have reserved as a trigger for COVID. And then last slide on this would be the ICU occupancy. COVID down just a little bit, non-COVID down, so bringing the totals down a little bit yesterday to today. Again, that line goes up and down between, say, 62, 63, 70, as high as 71. Again, 80% being a trigger that we look at. And so, again, holding relatively stable across the board there. That concludes my section of the report. I'll now turn it over to Dr. Wooten for a Public Health Officer's update.
Good afternoon, everyone, and thank you, Supervisor Fletcher. Global, national, and statewide statistics are based on the data that we obtain from the Johns Hopkins dashboard. And globally, as of noon today, there are almost 8 million positive cases, which includes over 434,000 deaths. Nationwide, the United States is reporting over 2.1 million positive cases, now at 26% of the total global number, and this includes almost 116,000 deaths. Statewide, California is reporting over 152,000 positive cases, which is 2% of the total number of global cases and includes 5,100 deaths. Today, the County of San Diego is reporting 9,610 cases, which is 170 more cases than reported yesterday, and includes 320 deaths, which includes one new death reported since yesterday. The age range remains the same, 3 months of age to 102 years of age. 53% of the total number of cases are between the ages of 20 and 49 years of age. 51% of the total number of cases are female, 49% are male, and 1,530, or 16% of the total number of cases have been hospitalized. Now, of the hospitalized number, 429 cases have been admitted to the ICU. This represents 5% of the total number of cases and 28% of the total number of those hospitalized. As of June 14th, the county has surge capacity for hospitalization at 34% and for ICU admissions at 37%. So at and above what our targeted surge capacity. If we look further at the deaths, we have, of the 320 deaths, these represent approximately 3% of the total number of cases. There was one new death that was reported as of yesterday, or since yesterday, and this is an individual, a male, in their late 70s that died on June 7th. Of the total number of deaths, 42% are female, 58% were male. 305 or 95% of the total number of deaths had underlying medical conditions, and 14 or 4% did not, and one is still pending. We have data for 99%, or 316 of the 320 total number of deaths. And of this total, that data is available for 137 or 43% are Hispanic or Latino, 131 or 42% are white, 38% or 12% are Asian, 9 or 3% are Black or African American, and 1 or 0.3% is Native Hawaiian or Pacific Islander. And our sincerest sympathies and condolences go out to the family members and friends of those individuals, all individuals who have lost their lives since this pandemic due to COVID-19. Since the beginning of the COVID-19 pandemic in San Diego County, we have had 104 outbreaks in congregate settings and in community settings. And as a reminder, congregate settings, particularly SNFs and long-term care facilities, are licensed and certified by the state, and the state does publish those locations that have had outbreaks. To provide context for these outbreaks, of the 104 outbreaks occurring since the pandemic, 51 or 49% are now closed or inactive, which means they have not had any new cases for 14 days or longer. Of the 104 outbreaks, 53 or 51% are still active outbreaks. Of this 53 number, 18 or 21% of that total are found in the skilled nursing facilities. And as a reminder, we have 86 skilled nursing facilities in San Diego. There have been no new outbreaks reported since yesterday in skilled nursing facilities. There are 22 outbreaks in non-skilled nursing facility or other congregate settings. No new outbreaks reported since yesterday in this group either. And then that leaves 13 active outbreaks in community setting locations, and we have not had any new outbreaks since yesterday in this category as well. Now, going to the next set of slides, we're going to review testing, cases, hospitalizations, ICU, and deaths If you look on the left part of the slide, that is either the summary or an average, and in this case, it's an average of the weekly number of tests performed for the week identified. And then additionally, on the right side, you have the number of tests that were performed each day. And the next slide, and before we go to the next slide, I just want to point out that in the last 4 days or so, we have had very high numbers of testing, and this is going to contribute to our first trigger being abnormally high, but that is not due to an expansion or an increased number of positives because the testing is not currently stable for that week. So once we get a week where they're consistently high, then our number for the first trigger will go back to normal, and we expect that to be less than 8%. Next slide. So this slide is the number of cases. Again, on the left, the weekly number of cases, and on the right, we have the last 16 days that shows the number of cases that have been reported to the county. So as you can see, the number of cases are not trending down, but staying between, say, 110 and 140 on average. In the next slide, we see hospitalizations, the same format, summary of the weekly hospitalizations on the left, and for the last 14 days, the number of hospitalizations, daily hospitalizations on the right. And then in the next slide, we have ICU admissions, and we can see that there is a slight decrease, but ever so slightly when we look at the weekly number of cases on the left. But for the 9 days on the right, the daily number of ICU admissions, there's approximately 2 to 3 admissions on a daily basis. And then in the next slide for deaths. Again, same thing on the left, the weekly number of deaths. And as we say and have shared with you, deaths lag behind the number of cases and the number of hospitalizations. So if you looked at this left side, you might think that this is trending up. But looking on the right side, you can see the daily number of deaths for the last 21 days, and particularly in the last 7 days, from 6/8 through 6/14, there's been about 3 deaths a day over the last, that 7-day period. And then the next slide is our epi curve. And as you will see, previously we stated that we peaked somewhere around April 20th to March 8th, but here you can see that there is as has been stated, a plateau effect with the peak. So it's kind of a long peak. The last 14 days, we expect to see more cases, but as we are also increasing the number of testing to get to that 6,600 or 5,200 for stage 2, 6,600 once we get into a full-blown stage 3, that also is contributing to the increased number of tests. And lastly, this is our triggers dashboard. And as I alluded to earlier, the case count is at 18%, which is above the 8% target because of the increased number of tests that have occurred over the last several days. But otherwise, all of the other triggers are green, and there is no yellow or red. So this keeps us out of the watch list that the state has and that Supervisor Fletcher alluded to earlier, where there are about 6 or 7 counties that are on that list because the metrics are abnormal. So with that, I'd just like to thank everyone for all that they are doing, and ask you to continue to keep up the good work. I'd just like to leave you with one statement from our Surgeon General regarding face coverings. Recently, he shared this message. Some feel face coverings infringe on their freedom of choice. But if more people wear face coverings, we'll have more freedom to go out. Face coverings lead to less asymptomatic viral spread, which leads to individuals being able to go to more places as more places open up and open up sooner. So all of us have a significant role and the power to take action to curb the spread of COVID-19. And we thank you for all that you have done, but we have to continue to keep up those efforts because we do not yet have a vaccine which would help us to achieve herd immunity. So with that, I'd like to please welcome back to the podium Supervisor and Chairman Cox. Thank you.
Thank you, Dr. Wooten. We'll go directly to the questions.
Matt Hoffman at KPBS. Please state your question.
Thanks for your time. Now that bars and clubs are reopening, over the weekend there were some scenes of sort of large gatherings outside some downtown establishments. Once these places have been working to make sure that the insides of their businesses are safe, but who's responsible for like corralling people outside, especially in downtown and beach areas where people aren't standing on a private lot necessarily, they're standing on like public sidewalks?
Okay, Dr. Wooten's going to respond.
Thank you for that question. That really fits into the messaging that we're trying to disseminate. So on Saturday, we found out about increased crowds that occurred on Friday night. And Supervisor Cox spoke with the mayor, and the streets were opened up so that businesses could extend into the streets. I think that businesses and restaurants specifically should know that we cannot accommodate the same number of individuals pre-COVID-19. So now that we are in the throes of dealing with this pandemic, we have to adjust. Our facilities have to accommodate individuals based on the social distancing strategies and also facial coverings. And we know that some people are not wearing them. It depends on where you go. We know that there are individuals when they go to grocery stores or convenience stores and some other businesses, that practice is adhered to. But going to restaurants, many restaurants will require, and we just encourage all of the restaurants to require that of their patrons. But in general, on Saturday, things were much better in the gas lamp in downtown. Thank you.
Just to follow up, in terms of like monitoring some of these triggers, I know last week for these community outbreaks in the county, if we had 7, then restrictions could come back. You guys said with more cases expected as we move to relax these restrictions, do you think realistically that we'll hit one of these triggers and have to move backwards, so to speak?
Certainly possible if people don't cooperate with the best practices that have been recommended, but we're hoping that we get the cooperation from the public. And our job is to continue to monitor and to support businesses so that they can adhere to the best practices that are recommended. Thank you.
Thank you.
Okay, next question.
Artie Ojeda at NBC7, please state your question.
Good afternoon, everybody. Just to follow up there on Matt's question, can you tell, I don't have a visual on the charts here where I'm at, but can you give me a count on the number of active community outbreaks that are under investigation right now? I know we're in the green, but I'm just kind of curious as to how many community outbreaks are under investigation right now. And also, in Arizona, and I know you've seen this, there have been more than 5,000 new cases from Friday to today. 5,000, that's an astounding number. Obviously, a lot of people come from Arizona to visit San Diego on vacation when it heats up. How are you monitoring those visitors, if you even can, and what are your concerns about, Tony's coming to San Diego?
Okay, Dr. Wooden's going to respond.
Thank you, Artie. So you had two questions. I'll answer the first one. Currently, there are 13 active outbreaks in community settings. So community settings include individuals' homes, any location that is not a congregate care facility. So it could be a restaurant, it could be a business, it could be a food manufacturing. But again, we have 13 active outbreaks currently that are in community setting locations. And then the second question, well, we certainly cannot track individuals that are coming from other states, whether it's Arizona or other locations where the numbers are increasing. And there are numerous states where now with businesses and activities increasing and opening up, the numbers are increasing. So our strategy remains testing. That's why we have our T3 strategy, which is the testing, tracing, and isolation of those that are ill, and quarantine for those individuals that have been exposed to those that have been confirmed to have COVID-19.
Yeah, as you guys mentioned earlier, Arizona and other states are a few weeks ahead of us. Does this present some kind of any kind of a warning sign, given the fact that there's been such a drastic increase over in Arizona?
Artie, I can't predict what's going to happen. The one thing that we can be reasonably certain of is that we will see increased cases as we open up. But the increase we hope that will not be to the point where it will impact or exacerbate our local healthcare system. That really is the major issue here. And as you saw from our triggers today, those healthcare triggers are all green today. So our best strategy is to focus on testing, tracing, and isolation, and then monitoring our triggers. And then if our triggers are abnormal, then that will help us determine what actions to take. Thank you.
Thank you, Dr. Wooden.
Okay, we have one more call-in question.
Paul Sisson from the Union Tribune, please state your question.
Thanks for taking my call. I wonder if you could elaborate a little more on the actions that were taken in the gas lamp and elsewhere. I think you said by the city in collaboration with your office to get folks who were very visibly congregating on the sidewalks in that area. Most people, from what I saw, online, stuff on social media without masks. What actions were taken that led things, as you said, to improve on Saturday? And is there a way to perhaps get on these things a little more quickly when you see large groups in public spaces like sidewalks just hanging out with no masks on, and pretty much in violation of your health order?
Okay, Dr. Wooden's going to respond.
Thank you, Paul. So as everyone knows, infractions that occur in various jurisdictions are handled by law enforcement in those jurisdictions. But the only thing different that I can tell you that we have not already shared is that our Department of Environmental Health also had dialogue with the industries and the associations for the gas lamp, and to try to solicit their support in helping us to make things better in the gas lamp over the weekend. And as I stated before, with that support from the Gas Lamp Association, as well as Little Italy, and also with support from the mayor to block off streets so that the streets could be used for additional spacing to place tables so that the social distancing strategies could be implemented. That's what occurred between Saturday night, or rather Friday night and Saturday night, and it helped to make the situation much better.
I see, thank you.
Thank you.
And another question, another thing that seems like it would be pretty nice right now is this technology-based proximity tracking that Apple and Google have been working on, where your phone would keep a running list of who you would have been within 6 feet of at all times. You know, as we see crowds that are now mixed of people who don't necessarily know each other, which is different from what we've been in for 3 months, where people have been pretty much in their homes with their household members. You know, how is that coming? Are you guys getting close to using some sort of proximity tracking in San Diego County?
Well, our epidemiology program has looked at that, and we will continue to look at other options that will, IT options that will help us. But we are currently not using that because of the fact that people have to opt in with that particular strategy, and we are concerned about confidentiality. So we will continue to explore, Paul, strategies like that, but currently we are not implementing that strategy.
Thank you.
Okay, Dr. Wooten, I know you addressed this earlier, maybe for further clarification for Jill Castellano from iNewsSource. She's asking, nursing home and senior care advocates have continued to call on counties to release the names of skilled nursing facilities and other congregate settings where outbreaks have occurred because the public should have this information when making decisions about where to go and where to send their loved ones who need medical care. Why is San Diego County not releasing the names of these facilities?
Well, first of all, the licensing and certification for long-term care facilities is coordinated by the state. And if you may not be aware, but the state has already created the process where facilities that have outbreaks, they are listed on the state's website. So that is already in place. And also facilities that have outbreaks are required to notify the family members. So there is no one that should know about an outbreak that doesn't know about the outbreak. All of the whether it's staff, all staff are informed, as well as the family members of the residents.
Okay, and this question is from ABC 10. Orange County last week relaxed its mandate on masks, and now they're only strongly recommended instead of required. Will San Diego take a similar step and revisit the mask order?
Well, every jurisdiction is different, and San Diego will continue mandatory face coverings for adults. We will be in alignment with the school's recommendation for students. So that is a strong recommendation. And we also recognize the fact that young students, and particularly in daycare, it is difficult for the staff and the students to wear facial coverings. And that group has, even before the school's guidance came out, we never required them to wear face coverings. But with the school's guidance coming out, we will align with that for schools, and then schools will follow the directions as best as possible. We do recommend for individuals with behavioral issues and learning issues, particularly kids that are autistic, teachers wearing the shields might be more appropriate than face coverings.
And this question is from Claudia from Univision. With bars reopening, any word on when and how party venues for weddings, first communions, sweet 16s, and similar celebrations will be allowed to reopen in our county?
Well, luckily, the state actually, we emailed the state, and they provided guidance back to us that weddings are now allowed, and they would follow the same recommendations for social distancing as has been provided for churches. So 25% of the facility or 100 individuals, whichever is less. And they also have provided guidance for outdoor weddings, but they do not prohibit receptions after the wedding. So weddings, but no specific receptions, which again presents the opportunity for people to gather and socialize. And that is prohibited by the state. Now, that currently is not found in the worship service. If you've read that document, you will know that previously it prohibited weddings. Now that language has been removed.
And this is from Sasha Fu from KUSI. I know you've talked about it a little bit, but she asks, I've observed that many people in public spaces, like in Balboa Park, are not wearing face coverings despite all the signs that say this is required. As the summer goes on, it may be more difficult to see compliance on this issue. How or what can the county do about this?
Well, our strategy is to continue to push the message and to require the jurisdictions where, in Balboa Park is in the city of San Diego, obviously, but all other jurisdictions to support that particular guidance. And by pleading to the general public and having our law enforcement help support this effort. And we recognize that everyone is not going to wear facial coverings. But we, again, encourage that, particularly when people go to restaurants, going to grocery stores and other businesses. And depending on what industry you look at, people are compliant because many businesses require individuals to have a face covering in order to come into their business.
All right, thank you, Dr.
Yes,
Wooten.
thank you.
Just one point of clarification. In regards to the gas lamp district, Friday night was pretty bad. And I had an opportunity to talk to Mayor Faulkner, and he was going to work with the police department. They were not in a position where they could get barricades up to kind of close off portions of the gas lamp district on Saturday night, but they will be doing that starting on Thursday. And that's all on the idea of trying to provide more social distance so that those bars and restaurants have more space where they can even put tables outside to accommodate more people. So we just wanted to make that clarification. So that's it for the questions for today. We are not going to be holding a media briefing tomorrow, but we will be back on Wednesday at 2:30, and updates will be sent to the media. Again, for ongoing information, please visit our coronavirus website, which is coronavirus-sd.com. And until Wednesday, stay safe, San Diego. Thank you.